Thanks for staying with us here on the Urban Debate. We now put the spotlight on the oxygen situation in our country. A crisis that exploded almost a month ago, starting off in a couple of cities, we saw the worst of the news coming in from big cities like the national capital. But a crisis that perhaps isn't getting talked about enough now, but is still as grave. It's just that the locations of the problem have changed. Newer places where cases are on the rise, where they did not still learn lessons perhaps from other states and cities, they are facing shortage. In many of the instances, even now, the hospital management is claiming oxygen shortage is not a problem, or the state is claiming it's not a problem, or the state is fighting with the center because it is a problem. But the problem exists, and we are losing lives because of that. The most recent news that came in, heartbreaking news really, from Panjim in Goa, where 26 people have died due to oxygen shortage at the government hospital. Goa is actually seeing some really scary numbers right now, and this has just become the next worst proof that we've got of it. In Andhra Pradesh, again, 11 COVID patients allegedly died after oxygen tanker got delayed. This incident was at a government hospital in Tirupati. The tanker was late only by a few minutes, but when it comes to those who are on oxygen support, COVID patients, it's literally a matter of life and death, those few minutes. There was another example from Hyderabad, where 7 patients died due to power disruption at a hospital, and the oxygen supply got disrupted over there. Chamarajnagar, 20 more people were dead, including 15 COVID patients, allegedly because of the shortage of oxygen. There's investigation being carried out over that. Incident after incident that's emerging from these states. Tamil Nadu, as of this evening, just a few hours ago, has put out an SOS. In fact, even told the court right now that they are looking at a dire situation where oxygen is now in short supply. Until now, Tamil Nadu was not one of those states that was actually facing this problem. Kerala is a state that has written to the center saying, well, our reserve stocks have gone from 400 metric ton to just about 85. And now cases are spiking in our state, and we can't give you any more oxygen. We, in fact, at some point, Kerala may also be staring at a shortage. So what's the current plan? We know the supply has gone up 3 times since the crisis exploded. But are we going to be able to pump it up further? Because this is not just a problem of a few cities anymore. This is now becoming a problem of more and more states, more and more towns, and even villages. Let's say good evening to the panelists who are joining us on this conversation. Saket Tiku, President for the All India Industrial Gases Manufacturers Association, Charu Pragya of the BJP, and Mahesh Bigala, of the leader of the TRS, joining us right now. Let me actually start off with Saket on this. Saket, can you give us an insight into what is the existing now system and situation of supply and demand?
Thank you, Tanvi, for having me on your show. Small correction. We started with 850 metric tons of oxygen per day, the consumption. And today we are around 9,000 tons of oxygen per day. So it's around more than 10 times. We are trying our best to ensure that the oxygen reaches all these deficit states. The good thing is there is a slight improvement. You will see now focus shifting from Maharashtra and New Delhi to other places like Goa, Jammu, Telangana, Karnataka. I'm naming these places where these places which have requested for higher allocation. Of oxygen quota, the so-called quota, whatever we're allocating them, now they are asking for more. So, but yes, I feel things will improve slightly after 7-10 days. In Maharashtra, it has shown improvement. Delhi, I don't think you will find, people queuing up and asking for oxygen in Delhi now, because Delhi is now a couple of days back, it was flooded with oxygen. In fact, Delhi did not know where to store the oxygen. 700 tons they asked. When GOI gave it to them, as per the allocation, they didn't know where to store it. So yeah, it took them some time. So I think things are going to improve from henceforth. Yes, now the focus is shifting to newer, smaller places, like smaller towns like Goa, and as I said, other places. We are ensuring we send them oxygen on time and as per whatever they're demanding. See, please understand one thing. Maharashtra was consuming close to 2,000 tons per day. Now, New Delhi was also kind of consuming 450, 500 tons per day. Now, when the cases are going down here, the demand for oxygen will go down here. And then that, whatever oxygen we are kind of saving in these states can be easily given to other states. And this also releases some tankers. As you are saying, we have limitation with the number of these specialized cryogenic vessels. Now, since the consumption of oxygen is going to go down slowly in Maharashtra and Delhi, so we can spare these tankers and send to the oxygen deficit, the towns and cities.
Okay, like you said, the demand locations have now changed and the entire system will have to be done accordingly, but you've stepped up on the supply, and so at least there is that level of oxygen now available for wherever is needed. If Mumbai and Delhi don't need it as much, it can be now diverted elsewhere. But Charu Pragya,
sorry.
Maybe we're not able to anticipate this. States are not, yes.
Sorry.
Yes,
please understand, we have also ramped up the production. We used to, around a month back, we used to produce around 7,200 tons per day, but now we are producing more than 9,000 tons per day. So with the support, with whether it's Government of India support or the manufacturers on their own, their engineers have done a marvelous job. It's not easy to ramp up the production in these cryogenic plants, but they have done it. Then we also got some help, where some foreign donations came in terms of, the liquid metal oxygen, which came and was sent to Delhi. So yes, overall, now we are ramped up the production. Earlier on, we were dipping in our stocks, but now we are not dipping in our stocks.
Okay, let me actually bring in Charu in as well. Charu, because while the supply, the production has been ramped up, we went into a war footing mode in the last couple of weeks. What we are now still lagging is to judge where the next set of disaster is going to strike, where the next round of shortage is going to happen, in ensuring that. How do we now plug in that loophole? I mean, we are still waking up way too late for states like Karnataka, Telangana, Goa, where people, after 4-5 reports of people allegedly dying due to lack of oxygen comes in, that's when we are able to move. So there's clearly a gap there. Charu, I think you're on mute.
Oh, apologies. Sorry. So, Tanvi, the best way to deal with the oxygen crisis is to have a two-pronged approach. It's not merely sufficient to ramp up the supply. It's not merely sufficient to set up new oxygen generating plants. We'll also have to ensure that the oxygen which we are getting is utilized correctly. There is no black marketing. We have a correct flow chart of how much oxygen a state is receiving, where this oxygen is going, which hospital requires how many metric tons of oxygen per day to survive, depending on the kind of patients they have. And I feel this is where we are lacking, and I'm going to make a blanket statement and say this is where we are lacking all across. Inclusive of my party governments, inclusive of governments of the opposition. And I see we have somebody from the opposition on the debate. Telangana has done terribly in this regard. But see, we have to understand that till we don't plug the loopholes, till we don't stop the black marketing, government issuing orders which say that retail of oxygen cylinders and refilling of these cylinders have to be stopped is not helping people. More than 90% of COVID patients are recovering at home, and 15% of these people need oxygen cylinders. So when you make a blanket order and you say that retail cylinders cannot be refilled, it's actually causing tremendous amounts of problem, and there has to be a strategy correction in the way oxygen is supplied from one center point in the state to all the various districts in a state, and from that particular district to the various hospitals. And here I think we require innovation, we require the bureaucracy to work in tandem with the politicians, and we need opposition and ruling party to come together for the welfare of the people.
So let me ask this question then to Mr. Bigala, because Mr. Bigala, Telangana is suffering, and it seems to be an example of a state that moves too slowly for every single thing. You move too slowly to bring in your lockdown until the courts actually came down heavily crashing on you, asking you tough questions. Now, more and more reports of oxygen shortage from various hospitals is coming in. Why are we behind the curve on everything and not learning lessons from states like Delhi or Maharashtra?
Tanvi, good evening. First of all, actually, see, if you look at that, when the pandemic was declared due to the COVID, it's a Telangana government is the first one moved, and then they supported the Modi government, saying that the lockdown has to be extended when the first lockdown was imposed. See, it's now when it comes to the second lockdown, the state government is evaluating, because compared to the other states, the cases are within the reasonable time. Within the reasonable frame where the government is assessing, and they have already imposed the night curfew. Now it's not due to the court or something; it's due to the government's committee. They have recommended, even all the medical professionals, they recommended that this lockdown is perfect for that this situation. But if you look at the overall situation in the entire country, don't look at the state by state. All the countries are in the lockdown. When the national government can do the lockdown, why to put the burden on the individual states? When during the first wave, then Modi government has imposed the lockdown, every government has supported. Why not Modi government take the same call instead of putting the blame on the states? Even for the example, like this oxygen now, to get the oxygen, who is controlling the oxygen supplies? It is the central government. But again, putting the blame on the states. See, Telangana government requires about, the central government has allocated about 360 metric tons per day, and Telangana government has already requested we need about 500 to 600 metric tons. But instead of taking the measures towards increasing the production, the central government, they have allocated 200 crores in the month of January, but knowing about what is happening globally, Europe and the rest of the South Africa and all other various, number of cases are going up. Even the health ministry in the central government has declared the victory over the COVID. It's too premature to declare the victory. And when they called, they needed about 160 plants they need to install. Even till today, even out of the PM cares, so they called the global tenders. Even till now, not even 30-40% of the plants have been up and operating. So this is the central government. It has been called by the central medical
but
service.
I understand that the center's responsibility exists. But Mr. Bigala, what are the state governments there for? If you're going to put everything on the central government, what is the state government's responsibility? If the center is not moving and announcing in lockdown for your state, what stops you? People elected you. People want you to take care of their health. People want you to ramp up healthcare infrastructure, create more bed facilities, organize oxygen, bring in a lockdown when it is required. This is very convenient that you wait till the end of Ramadan and Eid to take place and then bring in a lockdown and then say, oh, but the center could have announced it earlier. Why should we have to do this?
Absolutely, Tanvi. See, just the state is evaluating all the options, looking at partial curfew to the partial lockdown to the full curfew, so full lockdown. Because Telangana, the city of Hyderabad, it has so many labor migrants from different parts of India. So to create more convenience, people moving from one state to one place to another place. So Telangana government has been evaluating the situation, and because the central is not doing anything, the Telangana government took the step and imposed the lockdown already. And Telangana government, as a health department, they are doing their best to increase the infrastructure, medical infrastructure, and all the beds in district level. And even the CM's yesterday's in cabinet meeting, they have decided every minister in his cabinet, they are overseeing from each district, and with all the forming the committee with the collector and the government health professionals and everybody that to day-to-day review and the stock of what is happening in the state in the every district, and it is coming back to the state government. And the other thing I want to also point out, Tanvi, here, not only the oxygen, whatever they can't produce the oxygen in India, which may not be possible, like to ramp up immediately, whatever they could do. But the small time, actually, this oxygen concentrator being shipped from overseas, or even people are buying here. Central government is trying to make the money there also, imposing 28% GST even on the oxygen concentrators. After the hue and cry, everybody tweeted to the central government as if like they did something. They reduced it from 28% to 12%. Can't they waive it? And everywhere, even to clear the customs, like an individual portable, whatever they need, even the families are shipping to individual families, like when they need. The shipping is coming within 1 day, and they are stuck in the customs for more than
You
a
know,
week or 10 days. So this is the
we
bureaucracy.
were
What
just
is
we were just having a conversation about Maharashtra before this conversation of oxygen started, and how the Maharashtra and the Mumbai model, which the Center, Supreme Court, as well as research institutes in our country are right now talking about. The task force members there told me of how before this entire second wave hit us, the state had moved in terms of planning and organizing additional oxygen, rationalizing the use of oxygen. Mr. Saket Tiku has been on my panel earlier. He's spoken about how Maharashtra managed it well during the worst of its times. I think individual states also have to stop always blaming the center for everything, move timely, put up the right demand, make your own arrangements as well before you start doing that. Charu Pragya, you wanted to respond. Go ahead, please.
Yeah, Tanvi, I'll make this very quick. The point is that all the points which are being raised by my co-panelist, he fails to understand that the commissioner of your capital city, Hyderabad, himself has been saying that the city has been wrecked by people who are black marketing oxygen cylinders, people who are hoarding oxygen cylinders, and he's unable to figure out a way to deal with this. So when your own commissioner makes a statement like that, it reflects on the way the government has been running. Secondly, you have 70 metric tons of oxygen in reserves every single day. So 70 metric ton is a considerable amount of oxygen to take into account, and you cannot negate this. You cannot continuously keep asking for more and more oxygen. Also, since we are talking about learning from other states, I'm sure you've been following the news from Delhi. I'm sure you've seen how Delhi had unpardonable crises at hospitals, and we lost lots of precious lives because oxygen did not reach these hospitals on time, because these hospitals had to raise an SOS signal to get that very important oxygen. You've started doing the same thing in Telangana. Why are you waiting for an SOS signal to figure out which hospitals needs more oxygen? I was reading some news about King Koti Hospital. You've lost patients there because you failed to understand the demands in your very own capital city. So I would like to retaliate this and say this again, and I cannot say this enough. Please learn from things which have gone wrong around you. I am not making a differentiation between your state and a state which is ruled by my party, but let's understand that if you're not going to learn from each other and pick up best practices from other states, we lose more and more precious lives. Yes, corona is harming so many of our citizens, but then are we contributing to it by not being able to plan on time? Are we contributing to it to holding on to oxygen for the longest possible of time and not being able to distribute? And lastly, India has 30 states, sir. So many union territories to take care of. Vast geographical distances. The central government can give you oxygen, but from there onwards, you have to make sure your supply chain is correct. You have to make sure oxygen reaches the needy on time. And most importantly, and I'm going to make a humble request to your government.
You know, you've raised a very important point, Charu, and I want to take this across to the person who's part of the entire setup. Yeah, you've raised a very important point, which is, which is about timely moving. And the center can only supply to you the final endpoint distribution, allocation. You will have to do the planning. You will have to do. And Mr. Saket Tiku, and I'm not talking about any specific state for you to really speak about. But in general, how important is it that states who can anticipate, who are studying their data right, can anticipate how the cases may rise and where they may face a shortage, need to allot on time? Are these demands, last minute demands, coming in too late for you to change the entire allocation system and then divert some oxygen there?
Okay, let me tell you about my co-panelist from Telangana did comment on the allocation done by GOI, the Government of India. Sir, the decision, whatever is being decided when the allocation happens, it is not a unilateral decision. There are state health secretary, the entire team of that particular state, be it Telangana, be it Delhi or any state, Maharashtra. The health secretaries have to be present there. Secretary from industry is present there. It's not a unilateral thing. We decide that whatever allocation is asked or projected allocation is also given, So everything is taken into account and the allocation is proposed. Then the empowered group later on approves it if they find everything is okay. Now, the thing is, once the government of India allocates a certain quantity to a state, then it is the job of the state to ensure how they utilize that oxygen. Then there is an oxygen team in every state which decides how to distribute uniformly to refillers or to the hospitals in that particular state. The government of India, sir, does not take any unilateral. The allocation team does not take any unilateral decision. It is on board with the officers of those particular state. That's one. It's very important, to understand. Maharashtra and Kerala are the best role model states for other states to learn from them. Maharashtra state has got a marvelous team of officers. Secretary MED there, secretary from Maritime Board there, Transport Commissioner, FDA Commissioner. They're doing a wonderful job. There's no harm in learning from them. The other states can pick up the phone. There at the end of the day, they're all either the batchmates or the classmates, all these IS officers, and they can learn from each other. There's no harm in learning. But yes, oxygen management is very important by the state. You have to, some things didn't go well.
And I think the states who've managed it, gone through the worst struggle for the allocation, gotten whatever supply and managed it, need to now spread that word, spread their management plan with the other states who are now reaching that spot and are getting into a crisis mode. It's extremely important that we learn these lessons. India and the COVID wave in India is not the same across the country. Some have hit there early, some are getting there now, some are out of their peak already, and those lessons need to be learned for us to be able to simplify, streamline this process and save the lives. The oxygen crisis in this country has now gone on for a month. Much has been done in terms of stepping up on the production, channelizing existing oxygen from industrial zones, importing it, using the foreign aid, and so on and so forth. Much has been done to ramp up the supply. If the states today and hospitals today in different cities are struggling and not getting it, it is now also a problem of how we're not able to still react on time, communicate on time, and plan this and manage this properly. And so those states really need to look into this and work together with the central team. Completely out of time on this conversation. So I'm going to thank all of our panelists for joining us right now, viewers. It cannot be that a month into this crisis, we are still losing lives. Whether it's in Andhra Pradesh, in Telangana, in Uttar Pradesh, in Bihar, in Gujarat, in Karnataka, or even tomorrow in any other state. It cannot be that we can't get our oxygen management right even now. The center needs to help the states who are getting into trouble now, because the center has now been dealing with this for the last 1 month. You know the system, you know what works, you know where the supply is, what the transport hurdles are, where the backlogs are, and you move it. We are still staring at a situation where in a state like Haryana, which now has a higher caseload than Delhi, they're not getting the kind of oxygen they want. And this is a BJP governed state. We saw just a few days ago how the state of Karnataka was fighting for more oxygen. The center went to the court against the Karnataka High Court's order. It went to the Supreme Court and said, no, give us relief. We can't give them so much oxygen. All of this cannot happen. We need to sit on the table, plan ahead, see which direction you are headed, your cities, your hospitals are headed, and accordingly arrange and rationalize your oxygen use. That's the lesson we've learned from the states that have come out of this crisis now. Thank you so much for joining us on this conversation.